Welcome to the SIO monthly webinar. Thank you for participating with us today. As a reminder, the webinar will be recorded and posted on the SIO YouTube channel for your reference. If you have any questions for the presenter, please send them through the Q&A box at any time located in the toolbar. The presenter will answer all the questions at the end of the presentation. You can also use the chat box to contact our organizer directly if you have any technical difficulties. With us today, we have Dr. Susan Ryan presenting on effective tools for working with cancer patients and caregivers. Dr. Ryan earned her bachelor's degree from UCLA and her master's in marriage family counseling at California State University at Long Beach. She received her doctorate in clinical psychology from California School of Professional Psychology with the concentration in individuals, families, and children. Dr. Ryan has worked with many nonprofit groups and has devoted much of her career to working with trauma survivors. In 2012, Dr. Ryan was diagnosed with breast cancer. She has determined that good needs to come from her cancer experience, so she volunteers for Living Beyond Breast Cancer and other community organizations. In 2013, she presented at the International Society for the Study of Trauma and Dissociation on Illness and the Therapist. She spoke on a panel for the Sierra Group on accommodations for breast cancer patients at work. She's a provider for Unite for Her, a breast cancer organization, and facilitates a free biweekly support group for women diagnosed with breast cancer called In This Together Philly, which you can find on Facebook. She presented in the fall of 2020 at the Pennsylvania Psychological Association, Effective Tools for Working with Cancer Patients and Caregivers. Thank you, Dr. Ryan, for being with us today. We look forward to your presentation.
Thank you, SIO, for the opportunity to speak. And thank you all for being here today. A patient often asks, why me? It's a very common question and people often ruminate. People go through the what ifs. What if I quit smoking sooner? What if I didn't work in such a stressful, toxic environment? It's really an opportunity to give psychoeducation on grief. Once you give it a label, people are able to resonate with this experience and integrate the experience into their mind. As you know, a cancer diagnosis is traumatic for most people. Now forever, our name is associated with oncology. The exam room provides an opportunity to steer clear of blame. I'm not asking any of you to become therapists. I am asking you, however, to normalize feeling frozen, anxious, depressed, or suicidal. It's all normal with a cancer diagnosis or with a recurrence. Say something like, if you ever tell me you're suicidal, please do not fear that somebody's going to come and lock you up. I'll give you resources like the Cancer Support Community, Livestrong that provides free therapy, Unite for Her, which serves ovarian and breast cancer patients. Our center is here to support you, and there are many resources out there to help you. Why would you do this? David Finkelhor's research still stands today that the most valid predictor of how people get through trauma is the amount of support they receive. So let's support people from the start of their cancer journey. I vote for less money on commercials and more staff to support patients. What is integrative oncology from a patient's perspective? Well, of course, it's a physical part, right? Can you get clear margins with surgery? But most of oncology ignores the mind. Many patients experience sleep issues, anxiety, panic attacks, depression, feelings of suicide. Sometimes a patient will state that they feel guilty about cigarette smoking, alcohol use, or other behaviors. And I say, deal with it directly in the room. That was in the past. You have choices in front of you now. A lot of times people go through spiritual questioning of faith. That's normal too. Financial toxicity, as you know, is very common, especially for young survivors. Sexual side effects of treatment and or surgery, work performance, people are missing work. For some people, they've never heard of FMLA. There's sometimes fatigue, lack of focus. Some patients even end up leaving their career because they can't concentrate like they used to. Long-term side effects that impact the quality of life are out there. The loss of identity. Who am I without my real breasts or without my testicles? I can't do what I used to do. Where is my value? Because I've always based my value on my work. So a reorienting needs to take place, and people really need to understand that they're of value even if change occurs due to cancer. Of course, there's a social domino effect affecting the caregiver, the immediate family, the family of origin. Dr. Brian Lewinda, an oncologist at Genesis Care Northwest, states that breast cancer patients treated in institutions that offer quality integrative oncology care have survival rates up to 3 times higher compared to those treated in institutions with lower quality or no integrative care. That's amazing. Who knew that the nervous system was so vital? And this is really based on the work of Deb Dana, Dr. Stephen Porges, and Dr. Peter Levine. I want you to think of your nervous system like a ladder. You can travel up and down this ladder. And I want you to have awareness of the connection between your own body and your mind. In ventral vagal, we are safe, we are connected, we can think clearly. The world feels relatively safe. We can play, we can discover, we're curious, we can focus. Vagus means wandering in Latin. The vagus nerve, as you remember, uses its branches to go from your belly, your heart, to most major organs along that pathway. When you are in your sympathetic zone, you're mobilized. You're ready to fight or flight. The world is no longer safe. Your digestion stops, your heart rate increases, your breathing is shallow, quick responses to threats. As you can imagine, if kids live in a high stress environment, they can primarily live in fight or flight for years with cortisol or adrenaline traveling throughout their body. What does fight or flight look like? Well, it can look like inability to focus. It can look like problems with relationships, anxiety, panic, difficulty sitting still, tantrums, controlling behavior. Children growing up in high stress environments tend to pick high stress environments to live in as adults. In our business, we call it repetition compulsion. Bottom line is that people need to learn and master toxic environments. Sometimes they need to learn that they can let their nervous system live in a more relaxed state, even though it might feel very alien to them. Until that pattern is recognized and processed, though, the behavior usually continues. Diagnosis. Sometimes people can be frozen after hearing his or her cancer diagnosis. You can look at your patient and man, they look like a deer in the middle of the road, just standing there, which is why it is so valuable if a caregiver is with your patient. As you know, at that point in time, your compassion is vital. Sometimes there can be no evidence of disease, but yet the person is stuck. They don't travel. They live as though they're waiting for the other shoe to drop. They're not hanging out with their friends. They're not buying clothes. They're just in shutdown mode, in a kind of a collapsed mode. They may go to the oncologist guilt-ridden about their bad behavior, but guilt will not help. Cancer provides an opportunity to take a different path, moving the body more, forgiveness, the chance to stop avoiding issues and tackle them head on, eating better. It's elementary that the head and the body are connected, but the field of medicine, including oncology, largely treats patients as if their minds and their bodies are separate instead of seeing them holistically. There is a system of feedback loops in the body. Sometimes there's a sound followed by a physical reaction, and other times we get a feeling in our body, and then the thought follows up. For many cancer patients, any ache or pain might be assumed to be cancer, felt first in the body, and then the mind goes to a place of catastrophic thinking. Setting the stage for a good relationship with patients. When patients meet you for the first time, more than likely, they're going to be in that sympathetic state and they're going to be feeling disconnected from everybody, including themselves. And they might continue to feel disconnected as if time is altered. They might just be going through the motions of this diagnostic testing and the procedures. I'm going to encourage you to tell your patients, hey, use the patient portal. If you're having a new symptom or you need relief, it's probably the quickest way to reach me, because patients want to connect with their doctor. You're their expert. They are usually waiting to talk to you to receive answers, to get a plan, to get options, but more vital, they need hope. If there's any way possible, please review the chart before you enter the room so that monitor, that screen is not a barrier between you and your patients, because screens foster disconnection. Many patients that I speak with think that scribes are awesome because that means that the doctor is available to connect with them. Please tell your patient ahead of time if they might be seeing someone else in the practice, if you get backed up, or if you plan to transition them to another provider. Why? Why would you do this? This is especially important for people who have been through trauma, because we want patients to feel safe and in a vagal state when he or she come to see you. Child abuse statistics, 1 in 5 girls and 1 in 20 boys is a victim. And we can't forget about physical abuse, neglect, emotional abuse. You can also add in non-contact abuse like child pornography, voyeurism, and exposure. Health disparities. Man, this is such a vital topic because health disparities, our mental health are intertwined. And I'm really hoping that SIO might be open to a webinar on this soon. Building patient trust. This is so important. Before you enter the room, please just take a deep breath before you see your next patient. It is completely normal if you feel grief when you've lost a patient. Dr. Peter Levine, sensory motor psychotherapy, will tell you that you hold that grief in your body. He would probably suggest that you sigh, and I'm going to add, sigh like a teen girl, really dramatically. Allow your body to release that grief. Test results. Waiting for test results can be so hard, especially in the beginning when there's no treatment plan. What can patients do? Well, they can focus on themselves and allow their health to be a priority. According to Dr. Daniel Vicario at the University of California at San Diego Medical Center, they can also use visualization or other imagery because this can be very helpful. As some of you know, a new law was recently passed in Pennsylvania. Now, test results are often posted to the patient portal before the doctors even had a chance to call and tell the patient how significant the results are. For some, seeing results is reassuring. For others, it's greatly anxiety-provoking. Many patients will go to Dr. Google and work themselves up into a froth. And I'm going to say the internet is like chocolate. Too much is not a good thing. Patients will also go to Facebook groups for medical advice about medications. And I often remind people on Facebook that statistics can be deceiving when it comes to medications because only your medical team, knowing your medical history and labs and physical exam, can really truly tell you the risk to benefit ratio. I wish that oncologists would tell their patients, if the results look good, I will shoot you a quick message. If it's something else, I'm going to call you so we can talk about it. So I'd like to take some time to take the Adverse Childhood Experience Survey. What I'd like you to do is jot down tick marks on your paper. Yes is going to be a 1 and no is going to be a 0. And or you can keep track in your head, or maybe you already know your score. Before your 18th birthday, 1, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? 2, did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, ever hit you so hard that you had marks or were injured? Did an adult or person at least 5 years older than you ever touch or fondle you, or have you touched their body in a sexual way, or attempt or actually have oral, anal, or vaginal intercourse with you? Did you often or very often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close to each other, or support each other? 5, did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, and had no one to protect you, or your parents were too drunk or too high to take care of you or take you to the doctor if you needed it? 6, were your parents ever separated or divorced? 7, was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her, or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? 8, did you live with anyone who was a problem drinker or alcoholic, or who used straight drugs? 9, was a household member depressed or mentally ill, or did a household member attempt suicide? 9, was a household member, 10, did a household member go to prison? I'm just going to give you a minute to add up your score. Okay, so probably you're done adding by now. I just want to reassure you that if your score is high, don't panic, because the ACEs survey did leave out certain things, and I'm going to tell you what they are right now. They left out stressors outside the household: violence, poverty, racism, other forms of discrimination, isolation, chaotic environment, lack of services. They also left out protective factors, and these can be such a lifesaver for a kid: supportive relationships, community services, skill building opportunities. They also left out individual differences. Not all children who experience multiple ACEs will have poor outcomes, and not all children who experience no ACEs will avoid poor outcomes. Nothing is inevitable here. So I just really want to make that clear. If you have a high ACEs score, please do not panic once again. What it really just means is that you might be at greater risk. So, as I was saying before, ACEs really just provides a way of conceptualizing somebody's pre-morbid level of functioning, and a high ACEs score just means that someone might be easily triggered by the process of going through a cancer treatment. We commonly say, in my field at least, that kids are resilient, But the ACEs study clearly tells us that there are events that occur in a child's life which kids can feel for a lifetime, or it might even mean that they have to face an early death. We know that receiving a diagnosis of cancer can trigger past trauma responses. In 2011, a study demonstrated that patients who endorsed child abuse on a survey were 7 times more likely not to feel supported by their surgeon. Apparently, surgeons felt relationships with child abuse survivors to be more difficult. According to Bessel van der Kolk, unprocessed trauma is stored in the mind and in the body. The impact of trauma. Unfortunately, trauma can sometimes lead a kid to concluding that they are inherently unlovable. Sometimes kids just try to bury all those memories. And then as adults, they are diagnosed with cancer. It's such a blow because cancer is another trauma. It's so hard for child abuse survivors to be vulnerable because remember, they've grown up probably in fight or flight and their world is not safe. And so once again, their world gets rocked with this cancer diagnosis. There's no sense of empowerment. Once again, they feel as though they have no control. And so that's why it's so important for patients to be empowered, given the statistics of how many people have been through child abuse trauma. A sense of a foreshortened future is something that Dr. Herman talks about. I can see, it's not hard to see that this could easily lead to depression and possibly immobilization, existing in a dorsal vagal state after a cancer diagnosis. Because frankly, if somebody's in a dorsal vagal state, you can't hurt them if they're dissociated. And you can't hurt somebody who's already numb. The risk of suicide is twice as high as the general population, but patients with head, neck, lung, and pancreatic or cancers that can't be resected are at a much higher risk. The risk factors: psychiatric history, previous attempts, hopelessness, demoralization, lack of social support, depression, feeling being a burden on others, sense of a loss of purpose because your value and your worth are tied to work, fearing a loss of dignity, regret, and having cancer as a child. The most riskiest time is that first year of diagnosis, and the risk remains high for the first 5 years. The stage of disease also matters, meaning that the higher the stage, the greater the probability. If we look at elderly men, for instance, diagnosed with prostate cancer, they have a 4-fold increase in suicide risk compared to the general population. And in case you don't know, because I think it's useful to know things, physician-assisted suicide is legal in Colorado, Hawaii, California, Oregon, Vermont, Washington, and Montana. These are just a list of adjunctive treatments that can be very helpful for cancer patients. And also a couple of my favorite organizations, Unite for Her and Living Beyond Breast Cancer. Many of these things are available online, which is such a huge resource to people. They don't have to travel anywhere to receive them. But as I review this list, I can see that many of these things easily help transition a person who's in fight or flight into a place of parasympathetic, relaxed, calm, able to connect, able to be curious mode. Cancer in teens and young adults. Cancer rips teens and young adults apart from their peers freezing, or interrupting their emotional development. Teens are focused on going through treatment while their peers are concerned about dating, grades, acne, teachers, homework, AP exams, driving, who gets the car this weekend, part-time jobs, sports, band, where they are in their academic standing, clubs, headaches with parents. So teens as patients just want their old life back. Financially, young adults are not prepared for cancer and all of the decisions that go along with expenses. Decisions have to sometimes be made about whether or not to freeze eggs or sperm. The cost can be prohibitive because it's not covered by insurance. As you know, some cancers require chemo for years. What this means is sometimes friends will abandon the patient. The good news is some people abandon the patient while other people come closer, people who are more on the tertiary socially. And it might even mean relocating back home as a young adult because their support system isn't set up to be strong enough. Parenthood and cancer. I'm going to tell you, parenting takes a lot of physical and emotional energy. I mean, you probably already know. So I'm going to say, encourage your patients to ask for and receive help. This is crucial, especially for those patients that have been through trauma. If a patient says, "Oh, I'm so overwhelmed," have you thought in an after-school program? Tell your patient it's essential that you carve out time for yourself. Essential that you receive help. Cancer in men. Skin cancer can be really disfiguring for a guy. Depending upon the location of where the cancer is, that can be very tough. Prostate cancer is very hard on a man. Low libido, identity as a guy. If you are undergoing hormone therapy, your body changes, you can develop breasts, and you can't drink alcohol. Some of the side effects of cancer treatment. Well, there's hair loss, and you know what? So much of somebody's identity is tied up with how their hair looks. Sometimes after chemo, people with curly hair will have straight hair, or vice versa, or hair color comes in completely different. And menopause will also result in hair loss due to medication. There's bone health issues. Your breasts don't look the same, implants versus the real breasts. Early menopause. Take those young survivors. You're going to put them in medical menopause, right? And they're going to stay that way. But then when they get to be around 50, guess what? They get to go through menopause again. There's distress, there's depression, fatigue, insomnia, infertility, joint and muscle pain, hot flashes, vaginal dryness. Your body feels like a stranger. There's weight gain, problems with memory, concentration. You can have lymphedema after they remove the nodes that are in your lymphatic system. You can have neuropathy, tingling in your fingers, or it's hard to grip, and it can occur in your feet. There's chronic pain sometimes. Sometimes there's a new cancer caused by the chemotherapy or radiation. Sometimes there's cardiac issues caused by the chemo. And unfortunately, sometimes there's death. Oncologists sometimes really have no idea how bad the side effects can be for some of their patients. Patients sometimes do not want to admit the issues that they're living with because it would feel ungrateful. After all, their oncologist has saved their life. So Dr. Daniel Vicario, again from UCSD, says mitigate side effects of treatment by an integrative oncology approach. Ask your patient to view chemo as healing instead of as toxic poison, using healing therapies like acupuncture to help deal with side effects like nausea, pain, hot flashes. And cancer patients really do need that encouragement to advocate for themselves. Non-compliance in cancer treatment. Frankly, sometimes side effects are just too much. If you hear that in your patient's voice, complaints, or if you sense that, put it on the table. Ask if they'd consider taking a treatment break. Maybe you could just do a brief treatment break yearly. It's better that the patient take a treatment break rather than lying to you about medication. If they report weird allergic reactions to the medication, as you know, it's probably the fillers. Have them change manufacturers and see if they feel any different, and make sure that you check on them. Some women will have breast cancer surgery, and that's it, even though they increase their risk of dying by a whopping 40%. Why? Side effects of medications. The time it takes to get your labs done, the time it takes to go see your doctors, the time it takes to go in your chemo chair, the time it takes to recover, and the prohibitive costs. Would it surprise you that many of the people who refuse more treatment are women of color? Body betrayal. Surgeons tend to use the word mastectomy, but I'm going to say amputation is more descriptive. Sometimes surgeons complain that too many women are getting mastectomies. However, sometimes cancers are sneaky and they like to hide in that dense breast, or they simply don't want to show up on imaging. As a patient, you have to be able to sleep at night and not have those stress hormones flooding your body, so you might choose a double mastectomy. Because bottom line, patients have to learn to be friends with their body again. Because usually what happens with a diagnosis of cancer is there's anger, mistrust, and rage. These are very common emotions at the body. You feel betrayed by your body, especially if you've eaten well and led a pretty good life. Bodies become a battlefield with scars of demarcation. I prefer to think of my own body as having a good story to tell on the one hand, but I also have to allow for the other fact that in the beginning, especially in the beginning, it can really be hard to feel sexy. Body betrayal continued. So your body doesn't work the same it used to. The expectations have to change. Acceptance has to happen. But before that can happen, grief has to be processed. As people heal through surgeries, you might be able to say, I see that it's tough. How can I support you? And then here's what you do next. You refer to these great organizations that I've mentioned. You just give them some information, because with education, there's empowerment. Sometimes it can be very hard to focus due to chemo brain or anesthesia brain, the weight loss or weight gain that's involved with cancer. It can be so hard. It's hard when your clothes don't fit like they used to. It's hard as a patient to experience how tired or stressed our caregivers are because we have cancer. We have now become the source of stress for our loved ones. Intimacy. Well, with cancer treatment, your libido could really drop. A lot of times there's vaginal dryness, especially with women, and women might actually need to go through a process of using a series of dilators to help them open back up again. Sometimes there's a lack of confidence. The breasts are gone. Now the vagina doesn't work the same. Communication with her lover is crucial. Implants never feel the same as real breasts. Oftentimes, patients lose feeling on the surface of the breast. Some women do have nipple sparing surgery, but only 25% of them report sensation. Some docs do not regard this as important, but for most couples, breasts are a super important part of sex. And this isn't my quote, but I'm going to say the biggest sex organ is between your ears. Why exercise? Man, exercise can cut the risk of recurrence with women with breast cancer by a whopping 50%. Colon and prostate cancer, 20 to 40%. 7 types of cancer can be reduced by exercising: bladder, stomach, colon, breast, kidney, esophageal, endometrium. Better survival rates before and after prostate, colon, breast cancer. Sitting may increase your risk of developing lung, colon, endometrial cancer, and exercise helps to offset that risk. How much? You don't have to be an Ironman. Just 150 to 300 minutes per week. Weightlifting 2 days per week, 12 to 15 reps. Exercise reduces fatigue, improves sleep, mood, and bone health. It gives us a good rhythm to be in. A lot of times I tell my patients, sometimes the most dangerous place is not in the inner city, it's between your ears. So telling our patients to exercise gets them out of their head and into their bodies, especially with something like yoga, where they're really tuning into themselves. Food and drink. It used to be drink whatever you want, eat whatever you want, but we know better now. The World Health Organization has declared alcohol a carcinogen. And when I say that, I gotta tell you, I don't get a look of happiness. If you have hormone positive breast cancer, we're told to limit dairy. We're told to limit red meat. Junk food, which most people love, may really help activate the parasympathetic system in your nervous system. It might help you feel relaxed. It might give you a hit of dopamine, but it's not going to fuel a body well to fight infection. There are specific foods that lessen the impact of chemotherapy. There is a book called The Cancer Fighting Kitchen. Unite for Her packs this book into their care package for survivors, breast cancer survivors, that they send out. That's just such a wonderful organization. If the patients develop a body memory and aversion to ice chips associated with chemotherapy, suggest flavored ice or popsicles or slushies. Or if they want to just bring, they can do it at home. They can put whole food through a blender or food processor and freeze it. And maybe that's what they have during chemotherapy. Ways to turn on the parasympathetic system. This is so important. You can do just a 3-minute meditation. There is a practice called Yoga Nidra. I really love Yoga Nidra. It's really progressive muscle relaxation from what I can tell. Restorative yoga, another favorite. Exercise, great. Being around good people, people that are supportive, not people that take you into your fight or flight system, but people that help you stay in that calm, connected place. Scents can help you relax. Oncology massage, music, certain music is wonderful to help you get relaxed. Places or images of places. So these are just a few ways. Mantras can also help us because we have monkey minds, minds that are very, very busy, and we need to get them to move to a parasympathetic place. According to Dr. Mimi Guarneri, she gave an SIO oncology talk. She says to breathe in for 5 and out for 5. She says that gratitude will help our immune system. And she also states that would you be surprised to know that negative emotions are going to impact your heart rate. But gratitude and love cause the heart to be in inner harmony. You see, the heart is really like this conductor of an orchestra, easily influencing the other organs of the body to be in a relaxed state. So we have to be intentional. If we live a stressful life, we have to be intentional about giving our bodies that nice break. Fear recurrence, man, this can really tap into that dorsal vagal free state. And there are many triggers. The smells in the hospital, walking down familiar hallways, getting a voicemail from your oncologist. Usually there's lots of anxiety before scans and waiting for labs, so much so that oncologists have decreased running lab work. Dr. Bessel van der Kolk, a trauma expert, along with many others, are correct. Our bodies have a very good memory of where we've been and what we've experienced. 20 to 30% of people diagnosed with early stage breast cancer will go on to develop metastatic disease. So that's cancer that's spread to the brain, to the bone, lung, lymph nodes, liver. The good news is women can live for decades with breast cancer mets, which is unlike so many other types of cancers that have become metastatic. If you're a young woman and you've been diagnosed with breast cancer, it's likely that the cancer is aggressive, but this doesn't mean that she can't survive. It just means the journey might be tough. We know what keeps people on the planet, and these are their anchors, reasons to live, their family, their career, unmet goals. I want to let you know that in 17 studies involving almost 300,000 women, recurrence and depression are correlated specific to breast cancer, increasing the risk of death by a whopping 30%. If a woman is depressed, anxious, under 60 and under 5 years post-diagnosis, the prognosis is poorer. A study found that using group therapy really lessens depressive symptoms, resulting in a longer life. And I also want to let you know that David Kessler has written this beautiful book called The Needs of the Dying, which is very helpful. What helps patients when they're frozen, when they're overwhelmed? Well, I'm going to tell you, it's the little stuff. It really is the little stuff. And based upon the work of Dr. Bruce D. Perry, connection to others is imperative. Death is unavoidable. So I'm going to ask you, do you have an advance directive? Do you have a living will? Have you made your wishes known to your loved ones? What kind of funeral or memorial service do you want? A close friend of mine had someone play Grateful Dead songs at his memorial service. I want you to know that you don't have to be dying in order to call hospice for assistance, but patients do have to make the request through their doctor. Don't be afraid to talk about palliative care. Don't be afraid to ask your patients what kind of legacy they want to leave behind. I mean, this is such an important question. It can be simple stuff, recipe cards, quilts, future cards, future letters for their loved ones. It can be scrapbooks. It can be scholarships. It's such an important question. Remind your patients that they are teaching their kids how to deal with adversity. Caregivers, they need support and sometimes education about what to expect. Unfortunately, it's rare for a hospital or oncologist to check on a caregiver. Caregivers have to hang on to their identity. It can be so difficult when a patient asks the caregiver, shh, don't tell anybody about my cancer. And they swear them to silence. Because if that patient unfortunately progresses and the chemo stops working or the radiation stops working, now that patient is dying and that caregiver has no support. And if that caregiver notifies the support system, sometimes the support system feels shock, betrayal, anger, rage, and they might be slow to respond. It's so isolating for the caregiver to honor that privacy request from their patient. Caregivers need regular breaks. If the family can afford it, caregivers.com might be a good resource for them. Caregivers may need help with sleep. They obviously still need to have fun in their life, They have to prioritize spending energy on what really matters and use that support system. They need nutritious food for energy, and they need to be able to ask other people for help. These are resources for caregivers. Cancer Support Community Center, they offer so many free services for the patient, the caregiver, and kids. Facebook support groups. It's really important that caregivers don't push down their feelings and they forgive themselves for mistakes. What do you do for self-care? It's very important that you have your own self-care rituals in place. This is just a list of resources, and we will have all the sources for the workshop also posted on SIO. Thank you so much for your time. Thank you to Terry. Thank you to Steve. Thank you to my family. Thank you to Dr. Palavmeda. Thank you.
Thank you, Dr. Ryan. For anyone in the audience, if you have any questions, please post them in the Q&A for Dr. Ryan to answer live. And we'll just wait for those to pop in.
Okay, so one is, I had brutal chemo experience many years ago. I feel like I've had medical PTSD ever since. I haven't found a sympathetic doctor yet. That's really a problem. I mean, you're absolutely right. So cancer is a trauma, and it can also be almost like a secondary PTSD if you've been through child abuse, which you didn't say here. But it's very important to surround yourself with a therapist, a social worker, friends, someone who will help you feel better and to work on relaxing your body. So Dr. Bessel van der Kolk loves yoga for this reason, because it helps relax the body and the mind, and he specifically recommends it for trauma survivors. Okay, just a comment, very nice comment. Could you please talk about cancer massage? So, I've never experienced specifically oncology massage, but I actually have a friend that does it, and she did it for Unite for Her. As I mentioned before, Unite for Her is an organization here in the US. And if you're local, or maybe even in works, if you're not local, they will give you what's called a passport, and you can see an oncology massage person. And so that person is specifically trained to work with the body and help the body relax during cancer treatment. And, you know, that is so important, because a lot of times people are almost like cats on the ceiling. They're very stressed. And so anything that helps put you into that parasympathetic is very important. I know that somewhere we have a list of oncology massage people, and there's probably a national or international organization as well, but it can be extremely helpful. All right, another thank you. Morgan, that's all I see so far.
Yes, we just had a few actually come into the Q&A.
Okay.
I will read them. Thank you, Dr.
Okay.
Ryan, for the informative talk. Will the talk be available on the SIO website? I am a clinical psychologist from India and have recently started integrated breast health services. Could I have your email ID to contact you with further information? So yes, I can answer that. The recording will be on the SIO YouTube channel. All the attendees today will receive a link after the webinar. As for contact information, Dr. Ryan can answer that.
Sure. I'm happy to give you my email. It's Susan, Susan, Z as in zebra, Ryan, Ryan, @gmail.com.
Perfect. Another comment that we got, thank you, Dr. Ryan, for discussing ways to help the patient that are frequently missing from traditional care. Also missed is the care for the caregiver. And if that's it, no last questions from the audience. We'll see. I don't see any. Well, thank you, Dr. Ryan, for an amazing presentation today. As a reminder, as I just said, the webinar will be posted on the SIO YouTube channel and website, and also on social media. So please be sure to follow us on social media to keep up to date with all of SIO news.
Oh, one more thing. So Jane, thank you, Jane Green, just posted that S4OM/AMTA are organizations for oncology massage resources.
Perfect. Very nice. Thank you, Jane. Oop, another question. Will you also post a list of resources in a Word doc?
Oh, in a Word doc? Sure.
Okay.
I just have to, I'll put it together.
Perfect. And then I can distribute that to the attendees.
Sounds great.
Awesome. Well, thank you very much, everybody, for joining us today. And thank you, Dr. Ryan.
Thank you. Take care, everybody.